Imagine waking up one morning feeling slightly off. Your energy is lower than usual. You find yourself constantly irritated, unable to focus on the simplest tasks. Perhaps your immune system seems to be less robust. You catch every cold, and it takes forever to recover. You might also notice that your skin, usually so clear and healthy, has started to show blemishes or your nails appear brittle. What's going on? For many, these issues seem ordinary, just part of life's ups and downs. But for a growing number of individuals around the world, these are symptoms of something far more insidious: zinc deficiency. The silent struggler. Zinc's role in the body. Before we dive into the symptoms and science of zinc deficiency, let's step back and understand the importance of zinc. This mineral is often called a trace element because your body needs it in tiny amounts, but these small amounts are critical. Zinc is involved in over 300 enzymatic reactions in your body and plays a pivotal role in various processes such as immune function, protein synthesis, wound healing, DNA synthesis, and cell division. It also helps maintain the integrity of your skin and eyes and is essential for proper taste and smell. Without zinc, many biological processes would simply stop functioning properly. In short, zinc is one of the unsung heroes in our daily biology, and the absence of this micronutrient can have cascading effects on your health. Symptoms of zinc deficiency. The early signs. Now, let's get to the heart of the issue. How do you know if you're deficient in zinc? Unlike some deficiencies that are easily spotted through visible signs, zinc deficiency often sneaks up on you. The signs may be subtle at first, and they may be easily dismissed as something else. But here are the most common warning signals. Fatigue and weakness. Zinc plays a critical role in energy metabolism. When you don't have enough, your body's energy production takes a hit. This can lead to unexplained fatigue, making even the smallest tasks feel like monumental challenges. This is especially concerning because fatigue can be attributed to so many other factors, like poor sleep, stress, or a busy lifestyle. However, if you're experiencing persistent tiredness, it might be a clue that your zinc levels are low. Weakened immune system. Zinc is vital for the function of your immune cells, particularly T cells, which are essential in fighting off infections. A deficiency can result in a compromised immune system, meaning you're more likely to catch colds, flu, and even more serious infections. If you find yourself sick more often than usual, or if you struggle with lingering infections, this could be a sign that your zinc levels need a boost. Skin problems. Zinc is often referred to as the skin mineral because of its pivotal role in maintaining healthy skin. One of the hallmark signs of zinc deficiency is the development of skin issues such as acne, eczema, and dermatitis. Zinc helps regulate oil production in the skin and supports the healing of wounds. So, when zinc levels dip, it can lead to an increase in inflammation and an inability for your skin to heal properly. Hair loss. Zinc is crucial for hair growth and repair. A shortage of zinc can lead to hair thinning or even hair loss. If you're noticing excessive shedding or bald patches, it might be worth investigating your zinc intake. Hair loss can often be a frustrating and confusing issue, and many people overlook the role that nutrients like zinc play in scalp health. Cognitive decline and mood disorders. Zinc has a direct impact on your brain function. It influences neurotransmitter systems that regulate mood and cognition, and a deficiency in zinc has been linked to anxiety, depression, and even cognitive decline. If you're feeling unusually anxious, depressed, or find that your memory isn't as sharp as it used to be, a lack of zinc could be the culprit. Slow wound healing. As mentioned, zinc plays a role in cell division and repair. If you notice that even small cuts and bruises take longer than normal to heal, your zinc levels may be inadequate. This can be especially problematic for people recovering from surgeries or injuries. Loss of taste and smell. Zinc is directly involved in the senses of taste and smell. A deficiency can impair both, leading to reduced ability to taste or even the complete loss of taste and smell. This is one of the most distinctive and unusual symptoms of zinc deficiency, but it is often overlooked or confused with other issues, such as colds or sinus infections. Causes of zinc deficiency. Who is at risk? While zinc deficiency can affect anyone, certain groups are more vulnerable. Understanding who is at higher risk can help in early detection and prevention. Vegetarians and vegans. Zinc is found in a variety of foods, but animal-based products, such as meat, shellfish, and dairy, contain zinc in forms that are more easily absorbed by the body. Vegetarians and vegans, who often rely on plant-based sources of zinc, may have a higher risk of deficiency because plant-based zinc is less bioavailable. Pregnant and breastfeeding women. During pregnancy and breastfeeding, the body's demand for zinc increases significantly. Zinc plays a crucial role in fetal development and immune function, so a deficiency during these periods can have serious consequences for both the mother and the baby. Elderly individuals. As people age, their dietary habits and absorption rates can decline. Older adults may not be eating enough zinc-rich foods, and their ability to absorb zinc from the digestive tract may be compromised. Zinc deficiency in the elderly can lead to a range of health issues, including weakened immune function and cognitive decline. Individuals with digestive disorders. Conditions like Crohn's disease, celiac disease, and ulcerative colitis can affect the absorption of zinc from the digestive tract. People with these disorders often face nutritional deficiencies, including low zinc levels. Those with alcohol dependency. Chronic alcohol consumption can impair zinc absorption and increase the body's excretion of zinc, making alcoholics more prone to zinc deficiency. Additionally, alcoholics may have poor dietary habits, further contributing to the deficiency. People with poor diets. Zinc deficiency is often the result of inadequate dietary intake. Diets that are heavily processed or lacking in nutrient-dense whole foods may fall short in providing sufficient zinc. A diet rich in refined carbohydrates, for example, may not provide enough zinc to meet the body's needs. The science behind zinc absorption and metabolism. To understand why zinc deficiency is such a complex issue, it's important to look at the science of zinc absorption. When you consume food, zinc is absorbed primarily in the small intestine. However, several factors can interfere with this process. High levels of phytates, found in whole grains and legumes, calcium, and iron can bind to zinc, reducing its absorption. On the flip side, certain amino acids and acids in foods can enhance zinc absorption. Once absorbed, zinc is transported through the bloodstream, primarily bound to proteins. It is stored in various tissues, including the liver, and is utilized where needed. But the body doesn't store zinc for long. It's rapidly incorporated into enzymes and proteins, or it's excreted via urine, sweat, and feces. This means that zinc needs to be replenished regularly through diet. The path to healing. Addressing zinc deficiency. If you suspect that you might be dealing with zinc deficiency, what should you do about it? The first step is to consult a healthcare provider for a proper diagnosis, which can be confirmed through blood tests or other assessments. Once a deficiency is confirmed, the good news is that zinc deficiency is relatively easy to treat with dietary changes and supplements. For mild deficiencies, increasing zinc-rich foods is often sufficient. Foods high in zinc include meat, beef, chicken, lamb, shellfish, oysters, crab, lobster, legumes, chickpeas, lentils, beans, seeds, pumpkin, sesame, sunflower, nuts, cashews, almonds, walnuts, whole grains, quinoa, oats, brown rice. For more severe cases, zinc supplements might be prescribed. However, it's important to use these under medical supervision because excessive zinc intake can lead to toxicity, causing nausea, vomiting, and other health issues. Conclusion. Understanding zinc's essential role. Zinc may be a small mineral, but its impact on human health is enormous. From the health of your skin and hair to the functioning of your immune system and brain, zinc's role is vast and vital. The good news is that zinc deficiency can be prevented and treated with proper dietary choices and, when necessary, supplements. Paying attention to the early signs of deficiency can help you address it before it leads to more serious health problems. Zinc is a reminder that sometimes the smallest players in our body can have the biggest impact. By making sure you're getting enough of this essential nutrient, you're helping your body to function at its best, and preventing a range of health issues that can arise when it's lacking.